Burnout in Dentistry, Prevalence, Effects, and Coping Mechanism,
Test.
presenting by Dr. Mohamed AlShtail. Dr. Mohamed AlShtail was born and raised in Kuwait, acquired the Bachelor of Science of Chemistry, as well as the Doctorate of Dental Surgery from Dalhousie University. He has been practicing in AlShtail clinic for the government sector since 2021. Yeah, the stage is yours.
Thank you, Doctor. Awesome. Assalamu alaikum, ya'atikum al-afiyah, sabahkum al-khair. Thank you, Dr. Abdul Hamid, for this wonderful lecture. I always hated oral pathology, to be honest. That didn't change things. Fee clicker. Thank you. And just go, like, yeah. Okay. اليوم, I'm going to talk to you actually in English because I feel like for this specific topic, it's easier to explain things, easier to explain terminology. Not all of us speak Arabic in here, so I'll speak mostly in this. I'd like to thank the KDA for having me present this lecture for you today, especially the scientific committee, all of their members headed by Dr. Fahad al-Basri, of course. It is a heavy topic. Inshallah, يكون a light lecture for you guys, and hopefully you learn a thing or two. First of all, who here heard the word burnout? منو سامع بكلمة burnout? Like a few. Okay. Who of you knows what it means? Do you guys? 1, 2, 3, 4. ماشي. So burnout, the agenda for us today, we're going to talk about a couple of things. We're going to define what is burnout. We're going to say what is the definition for it, what's the history, how it started. We're going to talk about burnout in dentistry specifically. We're going to look at worldwide studies, what are the factors affecting burnout, what are the effects of burnout itself on us, coping mechanisms, healthy and unhealthy, and then finally we're going to talk about resources available in Kuwait for everybody. Summary and conclusion. A little bit about me, it's literally what the autobiography said. So I was a Bachelor of Sciences in 2017 in Canada. I graduated from Dalhousie Dentistry in 2021, and I currently work in Nahil Aslaimi in Khaytan since 2021. So I'm a GP, I'm not a specialist, so it's great. First of all, what is burnout? Burnout can be defined as a syndrome. It is not a medical diagnosis. That's the thing. It's a syndrome that is conceptualized as resulting from chronic workplace stress that has been affected multiple times and not successfully managed. It is added to the International Classification of Disease. That's the latest definition by it from 2019. For the sake of this presentation, we'll be focusing on occupational burnout specifically. So burnout caused in your own work and how that affects everything. A little bit of history. So burnout has been around since the start of time. We've all been stressed most of the time and everything. In 1869, this lovely gentleman, the American George Beard, used the term neurasthenia, describing a broad condition caused by exhaustion of the nervous system. It's just an umbrella term. This included anything that affects the nervous system in a different way. This got popular in the States. They nicknamed it Americanitis. So this was the sort of kind of thing for it. Keep in mind that 1869 was around the same period that scientists have discovered hysteria. So things were just completely new for them at the time. Skip to 1888. British neurologist William Gowers coined the term occupation neurosis, and it was added officially to the International Code of Disease in 1948. They've said, hey, there's something wrong going on with occupations. People are being different. So they started looking into the matter. Followed by that, in 1961, American author Graham Greene published a story, a novel called A Burnt Out Case. This was the first time that the term burnt out was used in a published sort of setting. This novel talks about an architect who has stopped caring about his work, who lost energy and motive to continue being an architect. So that's why they coined the term burned out to describe this specific situation. 1976, Christina Maslach, who is the American, she noticed that the term started being used as a colloquial term. People feel, oh, I'm burnt out today, or things like that. And in 1981, she teamed up with Susan Jackson, and they both started the Maslach Burnout Inventory, which was an assessment to fully actually assess burnout and see the degree of the effects that it has on people. After this, so you might ask yourself, why did I choose the topic burnout? We don't talk about burnout, we don't talk about mental health enough, especially in Kuwait. We're all affected by it. Burnout is one of the things that you may suffer or know someone who suffers from it, and you think that you're going through it alone, but you're not. Back in 2019, when I was in university, I did research, some original research. We did a survey. I was in Nova Scotia, which is a province. This research was around for 500 dentists who practiced in Nova Scotia, and around 93 of them responded. I looked at burnout in and out. I've gone through around 60 papers talking about burnout. I've talked about different things. We've looked at different factors like specialty, marital status, things. How does burnout affect or differ from one person to the other? We'll talk about more, but this is basically what my life is. It's all about burnout. So it was just a big thing in the back of my mind. To understand burnout, Christina Maslach and Susan Jackson put it down into three components to understand how burnout is affected, or how is it increased or not. The first one is emotional exhaustion. I'm going to define all of these in a bit. The second one is depersonalization, and then the third one is reduced sense of accomplishments. These three, no one factor is more important than the other. They all affect each other interchangeably. It's almost like a three-way scale, and how your variation of your degrees to measure each will determine how burnt out you are. To start off, for emotional exhaustion, it can be described as a feeling of being emotionally overextended and exhausted by one's work. It is manifested by both physical fatigue and a sense of feeling psychologically and emotionally drained. Who here feels tired after a long day of work and you feel like you have a low battery? Yeah, Kelena is the same. So this is emotional exhaustion. It is good to know that just because you have one of these things doesn't mean that you are burnt out. I'm not saying you are not, but we all have some sort of emotional exhaustion by nature. It doesn't differ. The second part of it is depersonalization, which means having distant or indifferent attitude towards work. You be negative, cynical, and you become objective of your cases. This includes inhumane attitude and negative feelings towards others. This varies from low to moderate to heavy. In extreme cases, some people stop looking at patients as human beings. They look at them as cases, that this person in front of me is just a tooth. No, it's not a human person with emotions, and you lose empathy, basically. That's the problem for depersonalization. Lastly, reduced sense of accomplishment is the tendency to negatively evaluate the worth of one's work and feeling insufficient in regards of the ability to perform one's job, and a generalization of poor self-esteem. I definitely sometimes look at a filling that I've done and I'm just like, this is a bad filling. I don't think that I did a good job. Someone is a prosthodontist, say they look at a shade, they don't think that they're good enough, or they don't believe that in their own abilities to produce good work, and that affects their self-esteem. Okay, so focusing on burnout in dentistry, dentistry is stressful. Anybody agrees? We're like, yeah. Dentistry attracts people who are naturally stressed. If you think about it, all the way back from the university days, from the competition to get into the university, from the competition to stay in the university and doing well, and then after graduating, you go over stress and stress and stress, and that is a constant exposure to stress in different ways. So burnout in itself, there are high prevalence rates of burnout in dentistry. There's papers that prove this. You can look at occupations. I've seen a couple papers that compare different occupations with different degrees of burned out. And dentistry does unfortunately score higher than other occupations. Lastly, dentists have sadly one of the highest suicide rates in terms of occupation worldwide. Unfortunately, this includes a lot of health professions. So we have physicians, we have ICU workers, we have different people working in different healthcares. The job that has the highest suicide rate is construction work, which is surprising because it feels like a repetitive kind of thing, but I see it. What are the effects of burnout? Well, it affects everything. And all of these affect burnout itself. So first of all, personal relationships. Your relationship with your coworkers, your family members, your friends. These are all could be affected negatively. You go back to the whole depersonalization, emotional exhaustion. You don't feel that you have the energy to socialize with friends and things like that. And it does. This can lead to clinical errors. Clinical errors, things like you drill the wrong tooth, you don't pay attention. You drill mesio-occlusal instead of disto-occlusal. You get distracted. These can all lead to clinical decision making. What if something happens as an emergency in the clinic? You don't feel that you're well equipped or you feel distracted to make correct decisions regarding your clinic. This overall decreases the quality of the patient care. So we are a very patient-centered profession. We always put the patient at first. This is beyond our needs. Doesn't matter what we have going on in our personal life. Once you go into the clinic, you are in the clinic. And we have sometimes difficulty separating the work-life balance. And we're going to talk about this in a bit. What are the factors increasing burnout? The number one factor in all of the burnout cases is stress. So stress is the number one reason why people get burnt out, because it's the constant exposure to stress, and that's the one that leads to burnout. We all have high patient demands, especially like if you work in a polyclinic. Sometimes you have 15, 20 patients waiting outside, all waiting at the same time, and you have the stress and the high expectations that you want to finish all of these people equally, because you want to give the same patient care quality to all people. Towards the end of the day, you get less and less and less. So by the time the 15th patient comes in, you should give them the same quality of care that you give the first patient. They've looked at the other things: time and productivity pressures, physical strain. We all get taught about ergonomics. Do we follow them? We try. Do we do them all the time? I have back pain. It affects us. We don't realize how physical our job is until the end of the day, where you kind of just bent over doing extractions all the time, or you kind of have strains on your shoulders and back and things like that. As I said or mentioned earlier, the lack of work-life balance. When does our life stop, our personal life stop, and then our work life extends? Sometimes we have difficulty differentiating between the two. Other factors: does specialty affect? Do specialists have more stress than GPs? Do married folks have more stress? Do separated or divorced people have more stress compared to single people? These are all factors that we're not very sure of. It differentiates from one place to the other. Could be, but correlation does not mean causation. It's just that, again, work-life balance is a little bit different to differentiate between them. All right, so let's take a look around the world. Have people studied in any of the pinned places? Australia, UK, people? Yeah. First of all, we can take a look at a study from Australia. So this was actually released in 2023, which was recent. They've looked at around 1,400 dentists. You can look at them. And they looked at the numbers. They've used the Sydney Burnout Inventory, which is similar to the Christina Masselbach Burnout Inventory. But these ones, instead of looking at emotional exhaustion, depersonalization, and reduced sense of accomplishment, they look at emotional exhaustion only and depersonalization. So those are the only two. The Masselbach Burnout Inventory is considered to be the one that is most often used. That's why there's a lot of papers that use it, the MBI system. But you definitely do see other papers like this. So Australian dentists are burnt out. Looking at Korean dentists, they've used the MBI system. They've looked at around 1,000 dentists. They found more than half is burnt out. Typically, or most people who were burnt out were people of the younger age. So younger dentists were more burnt out than the older dentists in Korea. After that, we can look at Singapore. Singapore here, also another different Asian country. They've also looked at people burnt out. We look at the UK. UK burnt out. We look at the States. The States look at the pediatric dentist, and specifically for this paper. Specialty does affect a little bit more stress here. So pediatric dentists, I'm sorry if there's anybody here. The most recent ADA communication report, the American Dental Association has sent a survey for all their American members, and the one thing in common between all of these studies is stress. So stress, this is the survey that they did for about 500 dentists, and they all looked at different stress-related factors. What makes you stressed? Is it the patients? Is it the things? And how often do you want to quit dentistry or think about quitting dentistry? That's one of the things. Like there comes some days where you're just in the clinic and you're like, what am I doing to myself? Why did I choose dentistry? Well, because I couldn't get into med school, but still, dentistry is still a little bit more stressful. You may ask yourself, what about Kuwait? Does Kuwait talk about mental health? Let's focus on Kuwait. I've only found 4 papers that look into burnout in Kuwait. Not specifically in dentistry. Actually, none of them are dentists. But the first paper I found was Burnout Syndrome in Physicians Working in Primary Healthcare Centers in Kuwait, or Mustasaf. They found that people are burnt out. This looked at nationality, difference in nationalities. They found that non-Kuwaiti doctors are more burnt out than Kuwaiti doctors in primary healthcare centers. Looking at burnout and surgical specialists. So they've looked into all 5 main hospitals in all of the provinces in Kuwait. They found that the surgeons, I think there was about 400 surgeons that they've surveyed, and almost 70% of them were burnt out. Another study here that looks at the predictors of depression and burnout among surgical residents. So the residents. This is not about burnout specifically, but they looked at the tendencies for anxiety and depression, and they found that there's a lot of the surgical residents have burnout. Lastly, some factors like COVID. We've all lived through COVID. COVID has been a stressful time for a lot of us. They looked at mental health of healthcare professionals or healthcare workers and students at the health sciences program in the Kuwait University. They also found that people are burnt out. So we're going to look at coping mechanisms. So we all have our different styles, different coping health, coping skills, things like that. It can be differentiated. This is to societal norms, let's say. So unhealthy coping mechanisms. Number one is substance abuse. Worldwide, there's alcohol intake in a lot of countries. There's drug abuse. People can tend to abuse pain medication, perhaps, or things like that, if they're having back pain or things. This can lead to drug abuse. Poor diet choices. I think I'm the last person to talk about poor diet choices, so we're going to skip this one. Withdrawal and isolation. People tend to think that if they are burnt out, that they're alone. So they tend to socially isolate themselves. They don't have a support system around them. They don't think that other people are going through what they're going through. But little do they know that we all are going through the same thing. Some people tend to overwork. People think, oh, I'm stressed because I don't have enough money. I don't have enough patience. Let me book my schedule fully, or let me oversee patients, or they don't take breaks. You tend to work yourself. That's an unhealthy coping mechanism. Neglecting self-care. When you can't take care of yourself, you can't take care of anyone else. So it has to start with you. You have to absolutely be and partake in self-care. Looking at healthy coping mechanisms, number one is seeking support. Having a network of close peers, close employees, close family members that you can talk to freely, not being scared of judgment. That can be a little bit difficult in Kuwait, but still. Quality sleep. I'm talking to you after running on 4 hours of sleep to finish this presentation, so I don't think, again, I'm the best one for this one, as well as physical activity. I'll explain how things are more than that. Setting boundaries is an important one. Learn to say no. A lot of us are people pleasers. We tend to give away ourselves for the sake of giving a quality patient care, or if the patient is always right. No, they're not. You don't have to sacrifice yourself to please someone else. Learn to take a limited number of patients if you need that. These all need to change. It's a lifestyle change. Lastly, we have practicing self-resilience, and I'll get back to this one later, with a toolkit. Resources available in Kuwait. So who here knows that there are mental health clinics in polyclinics? Does anybody know that? Anyone? No hands. Oh, well, I told you yesterday, so that's why. Oh, I see someone in the back. Okay. So I go around polyclinics in Kuwait to do some policy work and things like that. And I ran into this pop-up. It says World Mental Health Day, choose your best life. And here it says لحجز موعد للعيادة النفسية في المراكز الرجاء مسح رمز ال QR. Or if for you to take an appointment, you can scan this QR. And I got into the QR, and you can feel free to scan it if you want, because what it leads to you to is the official Ministry of Health website. So just like patients can take appointments online to go see the doctor or go see the dentist or something, anybody can take an appointment to go see the mental health clinic. Who can be seen in these clinics, certain cases? Say, for example, if I go to the clinic and I go to them, hey, I want to go see the mental health clinic or the mental health doctor. What will happen is that they look at certain cases. They deal with major depression, generalized anxiety disorder, panic disorder, and primary insomnia. Polyclinic doctors have the ability and capability to prescribe SSRIs and SNRIs, and they do cognitive behavior therapy and all of the other things. They are well equipped, or I hope that they're well equipped to do this. What I'm going to do is I'm going to report what has been told to me. I hope that everything in this presentation is true and that the polyclinics follow what they told me. But these are the things. I pulled this out of a protocol. I asked them to show me what their health clinic protocol shows. So this is written exactly from them in the polyclinic. You might ask yourself, how do they assess it? Or how do they accept patients? Some patients will ask for help. It's not bad, and it's not like it shouldn't be stigmatized to ask for help when you need it. You need to know that you're not alone. You need to check with professional help. If you have a toothache, you go to the dentist. If you break a bone, you go to orthopedic. If you have mental health issues, you go to a mental health doctor. It's the same. What do? They give you a screening. They do an assessment tool. They have the GAD anxiety ones and things like that. They know what they're doing. And then they will assess your level of mental health, whether you're stressed, depression, things like that. And then they decide if you can be seen in the polyclinic or you have to get a referral. Referrals have multiple different places. So if you have any presence of psychotic symptoms, so hallucinations, delusions, things like that, you get referred to the mental health hospital in Sabah. Admission, they do not admit everybody. There, they do further assessment. You don't necessarily have to be admitted. I know that there's a lot of people who are scared of like, oh, if I go, I'm gonna get locked up. Not necessarily. They have to assess to see if you are fit to treat patients. Just like when we all applied for our jobs anywhere, you get a medical exam, a physical, you do a full physical, you check your eyes, you check your things. Here they check your mental health. They have their own kind of things. If you're experiencing any suicidal or homicidal, there are emergency clinics for mental health. There are people who are well equipped to deal with these sort of things. If there's substance abuse or alcohol abuse, the addiction center, Kuwait Addiction Center, which is in Sabah as well, again, not necessarily get admitted. They check, they do assessments, and they are the ones who decide if you do need admission or you don't need admission. Bipolar disorders in the hospital, the mental health hospital, pediatric psychiatry, if less than 18, they also have their own specialty center to be seen by them. Earlier, I talked about resilience. So we talked about resilient, and it's a way to kind of counteract burnout. How can we be resilient? I have a toolkit here. I took this picture yesterday in the exhibition. There's a booth in one of the exhibitions that they have this picture. I got excited as a dentist. I got scared as a human because this is what the patients look at, and they think that we're psycho, which I don't blame them. Like if you come in and you see all this laid out at the table, and you're like, yeah, sure. So just like we use these instruments to as a toolkit to do extractions and things like that, we can be well equipped with a mental health sort of resources. I've summarized them, or I've used 4 E's, and these are given to me by a therapist and doctors that work in mental health, and I've done all the research with them with that. The first E that we do is engage. Build connections. Have a supportive system, safe spaces where you feel comfortable expressing yourself or simply being present without needing to talk. Positive social interactions help reduce stress and provide emotional support. Just like I said earlier, have your own network of similar people, maybe in your situation. Places like the KDA and having the Kuwait Dental Conference is a great opportunity to meet other people, to see other people from different perspectives, different specialties, different things. There are some people that I only see them in the conference. And I'm like, oh yeah, I've seen you last year. And that's how we do. Try to not necessarily have dentist friends. We get bored of speaking dentistry the entire time. Have people outside, elsewhere, things like that. So that's engage. The second one is enlighten. So enlighten your mind. how do you enlighten your mind, is you practice mindfulness, being fully present in the moment without judgment, by observing thoughts, feelings, and sensations without reacting to them. And mindfulness can help create mental space, reduce stress, and encourages a calm, centered mindset. So what does it mean? Sometimes thoughts can be provoking, especially for people with anxiety who tend to overthink things. I'm personally one of those. If you run into a situation where you feel stressed or something, try to observe yourself in the situation from a third person view. Look at the situation. Try not to analyze it. Try not to define what is going on. Try not to think of things to do. Just know what's going on at this moment. Like, I'm thinking to myself right now, okay, at this moment, I'm on stage giving a lecture to people. It's nerve-wracking. But I'm just acknowledging it. It's happening. Time is passing as we're doing. The lecture is going. 5 minutes. We're almost there. Sorry. All right. Get to do this. Embody. Align mind and body by engaging in activities that keep them focused on the same task, such as going for a walk, other rhythmic movements, techniques like bilateral stimulation, alternating physical. Basically what it means, if you move both sides of your body at the same time, this helps distract your brain from your kind of thoughts and things like that. Things like dancing, moving. If you're having a difficult case at the clinic and you're doing a filling or something like that, get up, get out, change your scenery, do things. Tell the patients, hey, like maybe 5-minute break. Close your mouth for a bit. We'll give you a break, but you take secretly a break, you know? Lastly is explore. Curiosity engages the thinking brain, the neocortex, rather than the reactive brain, limbic system, or brainstem. When we're curious, we shift away from survival mode. What this means is when we're anxious and stressed, our brain reverts back to the limbic system or the brainstem. You go into fight or flight. You don't have the ability to think of things from a third point of view. Engaging yourself in hobbies, things that you do with bilateral stimulation and things like that, that helps out. Okay, so at the end of my presentation, the future hope for all of this is that we do more research, especially in Kuwait. Kuwait is one of the places that are lacking in the mental health department. We need more people to talk about it freely. We need less judgment. We need less stigma. So if you don't want to be burnt out and end up looking like the wonderful ممثل حياة فهد القديرة, of course, I'm not making fun. Try to have self-care. And self-care differs from one person to the other. What works for me doesn't necessarily have to work for you. What works for you may not work for the other person. So just find your way of self-care and keep practicing it. And hopefully we'll all have a better mental health at some point. Thank you all so much. This was my time for you. These are my references. Awesome.
Thank you, Dr. Mohamed.
Shukran.
Do we have any questions? Anyone?
Anyone burnt out? Yeah. Front row. We're like, yeah.
You all good?
Thank you all so much.
Thank you very much.